I like E&M class because it gives us an opportunity to take all of our hard classwork, the basic sciences that we're taking, anatomy and physiology, and tying it into the hands-on side, getting with the patient, applying it to our adjusting techniques, our analysis of conditions, and really just treatment of patients.
In a very early part of the curriculum, students are working on management skills. They're working on actual treatments when they're only second semester here, which is so exciting for the student and allows them to really develop in these skills early on so that they're well under their belt by the time they're treating patients in the clinic. I do teach a course called Evaluation and Management of the Chest and Thoracic Spine. And in this course, we look at the major organ systems of the chest and thorax, such as the heart and lungs, the lymphatic system, the skin, the muscles and the related bones, and especially the spine of that area. Students are able to do things in a perspective where they're actually becoming a physician. This is not a college extension any longer. This is not similar to my college courses. I'm in a classroom, I'm learning to be a physician, do what doctors do. I'm collecting histories. I'm doing these exams. I'm taking, say, the blood pressure. I'm listening to the heart. I'm listening to breathing sounds.
Here we look at it as a whole patient encounter. So in other words, instead of teaching just thoracic manipulation, we're going to teach the evaluation and management of the chest and the thorax so they can learn how their management techniques fit in to the overall evaluation of the patient. So we don't separate out therapy from evaluation. It actually becomes one part of the curriculum. And they learn that very, very early in the curriculum. They're learning that in year one, which is much different than other traditional programs where they kind of wait till their students are done with clinical science before exposing them to clinical experiences. Teaching technique in isolation, teaching a technique course just by itself doesn't give the student the opportunity of starting to think like, well, when and where do I use this? What we focus on is teaching not only how to manipulate and manipulate well, but when and where is it appropriate. That's the biggest decision to make. It's not how do I do this? It's when do I do this? So that's why the E&M courses are critical in giving the broader picture of when my intervention is appropriate. The feedback from the students is that they're very happy to be exposed to clinical encounters early in the curriculum.
My favorite part about this class really is having an opportunity to feel like a chiropractor, to apply everything that we're going to be doing later on in practice.
Where can I begin to develop soonest as a physician as opposed to just getting more information? This is going to include a lot more, such as clinical reasoning skills, interpersonal skills. These are the kinds of things that we could develop best in these E&M packages, in these courses, where we begin to work with not just the evaluation aspect, but the management of the whole person. So I would want to know where that place is. That's why I think National University really has the advantage.